We are here at the Smithsonian Anacostia Community Museum in our new exhibit, Food for the People, Eating Activism in Greater Washington. And this exhibit is really exploring all different aspects of food justice organizing in the DC region, whether that is around the cultural meaning of food, the connection between food culture and gentrification and displacement, looking at that through foods like mumbo sauce, through food as a human right, and how the government is involved in our food system, and asking questions of how do we want the government to be involved in our food system? What would it take for everyone in our society to have access to healthy, nutritious food? We look at the grocery gap and the rise of supermarkets and how that has impacted society, and also all of the amazing organizing that especially Black women in DC have been doing over the past 60 years to create equitable food access across neighborhoods in our city, and how organizers and entrepreneurs today are picking up that mantle and continuing to do that work. And then, of course, we had to look at labor, the people behind our plate, and all of the issues, whether it's issues around wage, around safety, around dignity, that our food workers deal with at every part of the food system, from farm all the way to table. And why are there these inequities in that labor system, and how have people in DC, again, for decades and decades, been improving food justice in terms of labor in our city? So please come out and check out Food for the People. We have a special highlight of Food and Friends, and both the historical early days of Food and Friends, where people, just looking at how people came together to help their neighbors in a time pretty similar to today, when there were multiple serious crises going on, where there was a homelessness epidemic, the HIV/AIDS epidemic, and people came together in this for mutual aid and said, we are going to get food to our neighbors. I think the Food and Friends story also shed some light on how organizations like Food and Friends, like Capillary Food Bank or DC Central Kitchen, we see them today, and they're these big, awesome organizations, and are supported by our government, but that wasn't always the case. They had to fight to be able to get that support, that public money, to say we are doing important work, and we need that support from our government. And then we're also looking at contemporary Food and Friends, pushing forward, pushing the envelope on the idea of food as medicine, working with that Food as Medicine coalition to create a city and hopefully a nation where food as medicine, that really important element of health, is baked into our public healthcare system. So check it out.